Now, as we mentioned earlier, the Berg family continues to be traumatized by the deaths of three children in a fire yesterday. So how does one cope with this situation? We saw even the president issuing a statement on this tragic loss. We do have joining us now Dr. Shivan Mahabir, psychiatrist and host of The Present Mind on MCTV. Dr. Mahabir, good evening and thank you very much for joining us.
Hi, Rishi. Good evening. Thanks for having me.
Dr. Mahabir, it was a tragic situation yesterday where 3 children would have lost their lives in the fire. We saw the president issuing a statement, the prime minister, the opposition leader issuing statements on this. And I read somewhere where someone said, well, you know, I couldn't even sleep because I have 3 children as well. How does one cope with this situation?
Well, that's right, Rishi. In very public traumatic situations such as these, even persons who are not directly linked to the family or directly experiencing it may be affected. And those who have experienced past traumas of their own, such as deaths or losses or violence, may find that hearing about this situation may bring up difficult memories or emotions that they have to deal with. Now, it's important to remember that it is very normal to have a very wide range of feelings and reactions, and that over time, there is a natural healing process that can occur. But some of the things that come with a situation like this, you know, we start with denial, shock, numbness, right? Persons may withdraw into themselves. They may have a lot of sadness or anxiety. They may become very irritable. They may have feelings such as helplessness or guilt. They may have loss of energy and problems sleeping and loss of appetite and problems concentrating. So that there's a lot of different things that people could be experiencing. And I'll say again that, yes, our hearts go out to the family members, but even the members of the wider public watching on may be experiencing these things, and that is perfectly normal.
So then how do we deal with it?
So what I would say, there are several ways that there are several things that we should look at when we're coping with these sort of situations. And the first one is to give yourself the permission to experience your own thoughts and feelings. And you have the right to these thoughts and feelings, even if you are not directly affected. And remind yourself that these are normal feelings and normal reactions. And therefore have empathy for yourself and for others. In stressful times like these, we may not react in our normal ways. Try to talk about your thoughts and feelings. So choose a listener who's a person that you feel safe with. Make sure and take care of yourself. Make sure you're eating, trying to get regular sleep. Make sure that you're not, overusing alcohol, drugs, or caffeine. Pay more attention when you're driving, because sometimes in times like this, we kind of lose the ability to focus on our own safety and we may drive more recklessly. Be careful about what news you're taking in. Avoid the sensationalistic news outlets. And if necessary, speak to your boss and let them know, look, I need some time to cope with this, adjust my deadlines and so on. And finally, please feel free to seek support if you think you need it. And this could be from friends, family, the pastor. It could be from medical or mental health services. There are several hotlines that are available in Trinidad for persons who are having difficulty to call and speak to someone.
But the thing is, you mentioned something about workers asking for probably an extension in deadline from their company or the place that they work. We also need to make sure that, or how would somebody know that this person isn't just doing this because they want the extension in deadline?
Well, I think that you have to have some amount of trust and faith in your employees. And, nowadays we are more cognizant of the role that mental health plays in everything. To take us an aside for just 1 second, Simone Biles withdrew from the team gymnastics event at the Olympics because she felt that her mental health was being placed at risk. Yeah. So we need to understand that, even very, very highly trained professionals under stress can react in different ways.
And of course, we have the hotline numbers, Dr. Mahabir, that people can contact.
Yes, that's right. So we have the hotline numbers, which I hope we have put up.
It is on the screen, so people looking on can have it.
They can have it? Okay, great. Just one other point that I would like to make before we go is when it comes to children who may be hearing about this or experiencing it first-hand or second-hand, they require special attention, Rishi. They may show signs such as excessive fear, clinginess, nightmares. They may even start back tongue sucking or bedwetting. It is very important to give the child an opportunity to ask questions and respond in an age-appropriate way. Children hear a lot of things that adults are speaking about, and if you don't give them that information, they may get a distorted view of what is going on. That could actually make things worse. So, reassure the child. You might want to increase the amount of soothing physical contact with them and make plans with them so that they feel connected to you and feel safe.
Thank you very much. Some excellent advice. Dr. Shivan Mahabir, psychiatrist and host of The Present Mind on MCTV. Now to this story where the funeral for the late Lieutenant